Hi friends, today we are going to discuss about another child health nursing important topic, that is growth and development. Okay, in this section we are discussing about the principles also. Okay, so let's move to the topic. Okay, before going to the topic, I will just give introduction. See, growth and development. What is growth and development? Growth is a physiological maturation and the development is a functional maturation. Okay, both are takes place simultaneously. Okay, at the same time, the growth and development takes place. Okay. See, once growth and development is assessing from the baby on fetus, mother's womb also. Okay, as a baby is a fetus, we are doing the USGs and assessing the growth. Okay. Okay, let's move to the definition. What is growth and what is development? Okay, first one is growth. Okay, let's move to the definition growth. See, growth is a process of physical maturation. Okay, physical maturation, that is body development, that is increasing in the size of the body and the various organs. That is simply growth. Growth is the physical maturation resulting an increase in the size of the body and the various organs. Okay. In this case, there is a multiplication of cells occurs. Okay, multiplication of cells occurs and the size of the body increases. And the growth is a quantitative changes. Okay, quantitative means measure. There is having a value. Okay, it is measured in inches. That is, length is measured in inches and centimeters, pounds, kilograms, etc. Okay, that is a quantitative change. And the growth is a progressive and measurable phenomenon. Okay, progressive and measurable phenomenon. Next, we can discuss about development. What is development? It is a process of functional and physiological maturation. Okay, process of functional and physiological maturation of an individual. It is called development. Okay, and it is a progressive increase in the skill and capacity. Okay, it is a progressive increase in the skill and capacity. Okay, it is related to maturation and myelination of nervous system. It is related to nervous system. Okay, since it is a skill development, it is related to nervous system. Okay, it includes psychological, emotional, and social changes. Okay, and the unless they like the growth, it is a qualitative aspect. Okay, growth is a quantitative aspect and qualitative development is a qualitative aspect. It is difficult to measure. Next, we can see what are the stages of development. Okay, what are the stages of development? The stages are classified into two. That is, first one is prenatal period or intrauterine life. Next one is postnatal period or extrauterine life. Okay. Under prenatal period, they are classified into three. First one, ovum. That is 0 to 14 days. Ovum means 0 to 14 days after conception. And in case of embryo, that is 14 to 8 weeks. 14 days to 8 weeks, that is embryo. And in case of fetus, 8 weeks to birth, it is termed as fetus. Okay, that is under prenatal period. Next is postnatal period. First one, neonate, that is under 28 days. 0 to 28 days is neonate, that is birth to 4 weeks of life. Next is infancy, that is first month to, that is 28 days to 1 year or 12 months, that is infancy. Okay, then toddler, 1 to 3 years. Okay, then preschool or early childhood, that is 3 to 6 years. Next one, school age, that is for school girls, that is 6 to 10 years, and for boys, that is 6 to 12 years. Okay. Next, adolescent. Okay, from puberty to adulthood, that is adolescent. In early adolescent, for girls 10 to 12 years, and for boys 12 to 14 years. Okay, early adolescent. Next is middle adolescent or pubescent, that is 12 to 14 for girls and 14 to 16 for boys. And in case of late adolescent, 14 to 18 for girls and 16 to 20 for boys. Okay. Next, we can see the factors affecting growth and development. What are the factors affecting growth and development? Okay, factors affecting growth and development mainly classified into two. First one, hereditary or genetic factors. Next one is environmental factors. Okay, hereditary or genetic factors. Next one, environmental factors. Under hereditary or genetic factors, we are again classified into sex, and next one is race and nationality. Okay, sex, for male and female there is a different growth and development, and race and nationality means, for example, for Indians and Americans there is a different growth and development. Okay, that is race and nationality. Under environmental factors, there is prenatal and postnatal factors. Okay, we can see detailing. What are the prenatal factors? Okay, what are the prenatal factors? First one, maternal malnutrition, maternal infection, maternal substance abuse, maternal illness, and some hormones like thyroxine, insulin, etc. of the mother. Okay, next one, miscellaneous such as uterine malformation, malposition of fetus, oligohydramnias, polyhydramnias, because oligo means decreased amniotic fluid, poly means increased amniotic fluid. Okay. Then maternal emotion during pregnancy. These all are the prenatal factors which affect the growth and development. Next is postnatal factors. What are after the delivery? What are the factors? First one, childhood illness. Then nutrition. It's important, nutrition. Okay. Then growth and potential, physical environment, psychological environment, cultural influence, socio-economic status, climate and season, play, exercise, birth order of the child, hormonal influence. These are under postnatal factors. Then it's an important topic, asking many times, many questions. What are the principles of growth and development? Okay, it's important. Principles of growth and development. There are mainly three principles of growth and development. First one, cephalocaudal direction. Next one, proximo-distal direction. Third one, general to specific. I will tell you detail. There are three principles: cephalocaudal direction, proximo-distal direction, general to specific. First one is cephalocaudal direction. That is, cephala means head to tail. Okay, that is, growth will be in a head to tail direction. That is, increasing the length. Okay, the process of cephalocaudal direction from head to down to tail. This means improvement the structure and function come first in the head region, then in the trunk, and last in the leg region. Okay, that is cephalocaudal direction. Improvement first in the head region, then trunk and leg. Okay. That is cephalocaudal direction. Next one is proximo-distal direction. What is that? Proximal means midline to extremities. Near to far, that is proximo-distal. Growth takes place from near to far region. Okay. The proximo-distal from center to midline to periphery direction. Okay. Center to periphery, that is proximo-distal direction. Okay. Development proceeds from near to far, outward from central axis of the body towards the extremity. Okay. That is simply proximo-distal direction. And next stage is general to specific. What is general to specific? Which means children use their cognitive and language skills to reason and solve problems. Okay. And first they hold the big things. Okay. Big things first they hold. Then these big things by both hands first. Then they are holding the big things by single hand. Then they able to pick the small object like peas and cereals. That is general to specific. Big to small items. That is general to specific. And okay. Then they can able to hold a pencil. First they draw the circles, then squares, and then letters. After that it will develops. Okay. Development proceed from general to specific responses. Okay. Next what are the assessment of growth? Okay. How we are assessing the growth of the baby. First one, it is done by anthropometric measurements. What are the anthropometric measurements? For these we are using certain criteria. So okay, first one, weight. We are assessing the weight of the baby. Then length or height. Then head circumference. Then chest circumference. Then mid-arm circumference. Then others, which includes BMI, body mass index, fontanelle closure, dentition and bone age, that is teeth growth. Okay, and bone age. These are we are assessing. So first we can see what are the weight calculation, weight measurement, how weight measurement occurs. Okay, weight is the one best criteria for assessing growth and development and health and nutrition status of the child. Okay, weight is best indicator. Normal newborn weight we all know 2.5 to 3.5 kg. Okay, and newborn loses 10% of weight during the first week of life. Okay, due to the adjustment problems and extra loss of cellular fluids, inadequate feeding. These are the reasons for loss. It is quite normal. Okay. And in the next 5 to 6 months, 13 gram per day weight increase. Okay, for the next 5 to 6 months, 30 gram per day weight increases. And after that, until 12 months, that is 6 to 12 months, 15 gram per day weight increases. Okay, 15 gram per weight increases. So weight calculation. First, the weight is doubled by 5 to 6 months. Okay, if birth weight is 2.5 kg, it will be reached to 5 kg by 5 to 6 months, and it will triples in 1 year, that is it reached to 7.5 kg. Okay, and 4 times in 2 years, 5 times in 3 years, 10 times in 10 years. It is asking in every multiple choice questions. Okay, PSC, Kerala, all aims questions they are asking. And what are the weighing machines? Okay, electronic weighing machine. Example, this one. Okay, then this is manual weighing machine. Okay, and this is Salter weighing machine. For your knowledge, it is telling. The next one is height. Height assessment. Okay, height, increase in height indicates skeletal growth. Okay, Increase in height indicates skeletal growth. Normal baby height is 45 to 50 centimeter. Normal baby height 45 to 50 centimeter. And during the first 6 months, there will be 2.5 centimeter per month increases. First 6 months, 2.5 centimeter per month increases. Next 6 months, 1.25 centimeter per month increases. Okay. And during 1 year of age, the height will be 75 centimeter. That is 50% of the birth height increases. Okay. If baby's height is 50 centimeter, it will increase by 50%. That is 75 centimeter. Okay. Sorry. In second year of age, 85 centimeter. Third year, 94 centimeter. And 4 year, it's double at birth height. Okay, double at birth height. It is important asking in exams. Double at what age baby's height will be double? That is 4 year. And triples by 13 year of age. Okay, it is also important. Triple by 13 year of age. And the height estimation formula for 2 to 12 years. That is age in years into 6 plus 75 centimeter. Age in years into 6 plus 75 centimeter. That is height estimation formula. Then up to 2 years, there is a recommended length, that is supine length is SSC. Okay, I will show you. Height measurement, it is recommended measurement. Okay, supine length is measuring. Then this is standing length. Okay. Next we can assess how to assess the head circumference. Okay. This normal at birth, normal head circumference is 33 to 35 centimeter. Okay. And the head circumference should be assessed after 48 hours of birth because molding may cause false measurement. What is molding? During the time of delivery, the baby's bones will be overlapping. Okay. So it will give false measurement. So rate of increase of head circumference, which includes in first 3 months 2 centimeter per month increase. Next 4 to 6 months 1 centimeter per month increase, and in 6 to 12 months 0.5 centimeter per month increases. So at 3 months its circumference will be the 40 centimeter. At 6 months it will be 43 centimeter. 12 months it is 45 centimeter. 2 year 48 centimeter. 7 year 50 centimeter, and 12 year 52 centimeter. And head circumference is measuring by ordinary inch tape. Okay, and it is measuring like this. Okay, which is the tape is placing in the prominent part of the forehead. Okay, and it is rounding into the widest part of the back of the neck, back of the head. Okay, and it is assessing like that only. Next one is chest circumference. How to assess chest circumference? Okay, chest circumference or thoracic diameter assessing the growth and nutrition status. Okay, it's important. Growth and nutrition status. At birth, it is 30 to 33 centimeter. 2 centimeter lower than head circumference. Okay, at a birth, chest circumference is less than head circumference. Okay, and at 1 year of age, it will be equal. It is asking important. It is asking every exams. Okay, but at the 1 year, head circumference equal to chest circumference. Okay, and after that, the chest circumference will increase than head circumference. Okay, and after first year, 2.5 centimeter chest circumference increases. Okay, and by the age of 5 years, it is about 5 centimeter larger than the head circumference. Okay, simple. Next, chest circumference is measured by placing the tape around the chest like this. Okay, around the chest at the level of nipples. Okay, at the level of nipples, we are assessing the chest circumference in between the inspiration and expiration. Okay, then only we are. Next one is mid-arm circumference, MUEC. Okay, mid-arm circumference, MUEC. It is used for assessing the nutrition status of younger children. Okay, MUEC. The average MUEC at birth is 11 to 12 centimeter. At 1 year, 12 to 16 centimeter. 1 to 5 years, 16 to 17 centimeter. 12 years, 17 to 18 centimeter. And at 15 years, it is 20 to 21 centimeter. This tape is known as MUEC tape. Okay, MUEC tape. This MUEC tape. And to assess the MUEC, the left upper arm is measured firmly and gently without compressing. The left upper arm is measured. Okay, and the tape is placing at the midpoint of this is olecronium process and this is acromion process and this is polychromion process. Okay, in between this. Okay, barely midway of acromion process and olecronium process, the tape is fixing. Next is developmental milestones. What are the developmental milestones? See, development is the maturation of the organs and functional maturation of organs. There will be brain development, neuronal development. Okay, these are neuromuscular maturity, genetic determinants, and environmental influences. Okay, see, development is assessing under the following domains. First one, gross motor development. Second one is fine motor development. Gross motor means holding big things. That is gross motor development. Fine motor means through the fingers, by the fingers. It is fine task. That is fine motor development. Then language development, personal and social development, sensory development like vision and hearing. Okay. So what are the gross motor, fine motor, speech, language, social developments by age? At the 6 weeks, there is a gross motor. Under gross motor, good head control will be there, and stabilized head when raised in sitting position. Raised to sitting position. That is in 6 weeks. And in fine motor, tracks objects. Okay. And in speech or language, start a loud noise. And in social smile will be there. During the 6 month of age, sit without support and roll tummy to back. Okay. Then in fine motor, palm or grasp will be there. Transfer hand to sub objects from hand to hand. Okay. Then in speech, in case of speech, turns head to loud sounds. Then understand bye bye. Okay. Tata will be saying and babbles. Okay. And social, put objects to mouth. Shakes, rattles. Rattles, they are shaking. Reach for bottle or breast. Okay. These are by 6 month. In case of 9 month, stands holding on. Okay, straight back sitting will be started in 9 months. And in case of fine motor, inferior pincer grip will be there. Then response to in speech, response to own name. Okay, while calling name, they will respond. Okay, imitates adult sounds will be there. In social, strange fear will be there in social. Then holds and bite food. Okay, in 9 months. In 12 months, walks alone. Okay, walks alone. And in fine grips, near pins grip. And in case of speech, shows understanding of nouns. Where is mommy? We are while we are asking where is mommy, they are responding. Okay. And in social way, bye bye, then hand clapping, plays on familiar person nearby, etc. In 18 months, runs and jumps. Then in 2 year, runs tiptoe, walk upstairs, both feet reach step, throw balls, etc. Then 2.5 years, kicks balls. 3 years, hops on foot or steps, 3 steps, walks upstairs by 3 years, and by 4 years walks upstairs, downs in adult manners, etc. And they develop the fine motor, which includes crows. 12 blocks will be arranged. 12 blocks will be arranged, and square triangles will be writing and drawing, and cuts paper in half, small beads. Okay, and then understand complex instructions will be understand by 4 years. Then concern sympathy or for others if hurt, and has best friend. Bladder control will be there. Engages in imaginative play, observing rules. Easy to skillfully with a little help. Handle knife at 5 years. Dressing and undressing will be do by 5 years. Okay, these are the fine and gross motor development. You can read this table. Okay, everything will be cannot explain. Okay, it's just a simple, you can understand it only. And during the first 2 month, okay, 1 to 2 month, able to lift the chin momentarily and able to regard bright colored objects, they turn the head, and cries when hungry or discomfort, and able to turn head when uh, hearing any sound, or smile back to the caregiver. This is in 1 to 2 month. Next, 2 to 3 months, able to lift head and front part of the chest by supporting weight on extended arms. Okay, this in 2 to 3 months, and can follow moving object with a steady eye movement and able to focus eyes, and produce cooing sound, and talking with her mother or caregiver, and able to recognize mother and turn head to sound. These are coming under 2 to 3 months. You can read it. Okay. Then 4 to 6 months, can hold his head steadily in upright position. Okay, and able to hold a rattle and bring to mouth. Then grasp rudely with the palms, and make a coos or gurgle sounds will be there, and join hands together in play and enjoying peoples. Okay, enjoy people and laugh out loudly in 4 to 5 months. In 5 to 6 months, able to sit with the support, okay, and can hold a cube and transfer from one hand to another. Then try to imitate sound of the others. Enjoy mirror image. It's important. Enjoy mirror image. It's 5 to 6 months. Then 7 to 8 months can sit without a support. Roll in bed from back side to then back to abdomen. Then producing bubbles and say da la. Then recognize unknown persons and show anxiety. Resist toys to be taken from him or her. These are okay. Then 8 to 12, 9 months. Able to crawl on abdomen and speak dada mama combining syllabus siblings without a meaning. Okay. Then 9 to 10 months able to creep on hands and knees, can stand without with the support, able to pick up a pellet with the thumb and index finger, wave bye bye. Okay. Then 10 to 12 months can understand stand with the support and walk holding furniture. Then able to feed himself with the spilling. Then pick up small bits of foods. Pick up small bits of food is important. Okay. Then can speak 3 to 5 meaningful words and respond for affection by kiss. Okay. Then toddler, that is 1 to 3 years to toddlers, for 1 to 15 months able to walk alone and can walk several steps sideways and a step backward. Then can feed him or herself without spilling. Okay. Able to turn 2 to 3 pages at a time. In by 18 months can creep upstairs, able to feed from cup, build a tower of 2 blocks and stop taking toys to mouth. Okay, use 16 to 20 words, 6 to 20 words, then copy mother's action, 140 point and part of the body if asked. Next is 2 year, able to run and climb to the upstairs by resting on each steps, put shoes and socks on, build a tower of 6 to 7 blocks, can copy run horizontal and vertical line, control bladder at daytime, speak simple sentences without use of verbs. Okay. Then 3 year, can walk in tiptoes and stand on left leg or one leg for seconds and climb upstairs for coordinated manner by coordinated manner. Then ride tricycles, can dress and undress, then build 9 blocks, okay, and achieve bladder control at night also, okay, at 3 years. Then has vocabulary of 250 words and play simple games with the peers. And in case of preschool, that is 3 to 6 years, can jump and hop, able to draw cross by 4 years and a tilted cross by 5 years. Okay. Then can draw rectangles by 4 years and triangle by 5 years. Can tell stories and describe recent experience. Okay. Then school age 6 to 8 years. Able to run, jump, hop and climb with a better coordination. Develop a hand-eye coordination. Okay. And able to write better and take self-care. Able to use complete sentence using sentence to express meaning and follow commands. Play groups. Sorry, play in groups. And 8 to 10 years, these are you can read only. Okay, you can read and understand what are right, which include which are used. Simple points are including. Play actively with the different physical skills. Improve writing skills and speed. Use short and compact sentences. Participate in family discussions. Peer group involvement will be there. And in regarding 10 to 12 years, the development more coordinated, skillful manipulative activities and games. Able to use parts of speech correctly, accept suggestions and instructions obediently, and may show short burst of anger. So these are coming under growth and development. It is a vast subject. You can read easily, okay, and understand in everything. So thank you.